Great Barrington Declaration states that the evidence does not support the measures that are being carried out by public health. Masking, social distancing, lockdowns, those are not based on science, and that's pretty clear now. In the very beginning, we were wondering what to do. We had this deathly virus coming our way, and so some of those public health measures were put into place because of the unknown. But now we have had data since at least April that shows that we actually did not have a true pandemic. Now, when I say that, it means that the number of deaths in every country in the world in the period of time, let's say February, March, April, May, did not exceed what people had been experiencing in the previous years. And so we really haven't had an excess death toll, which in the past, before 2009, when the WHO changed the definition of a pandemic to accommodate the bird flu, H1N1, this would not have been considered an epidemic. And what we're seeing now really is a case-edemic. Now, what that means is that we're constantly being told that there are more and more cases. There's 400 today, 1,000 tomorrow. But these are cases based on this PCR test, which is inaccurate and giving us at least 90% false positives. Much higher, perhaps, maybe even 97% false positives. So if we're basing all our actions on that inaccurate PCR test, then we're going to go far astray, and we have. That evidence has shown that in the previous policies coming up to May for the first so-called wave, the deaths from the policies were about 10 to 1 compared to the deaths for COVID itself. And other people have evaluated up to be at least 50 to 1. So that would include starvation, suicides, overdoses, people not getting proper treatment for their diseases, delay of diagnosis, many different things which have caused that. And that's not including all the psychological damage which we will be seeing over the next years. It's going to roll out depression, anxiety, so many different things. And the way we're propagating this is simply by fear. The fear is causing people to follow public health measures which do not make sense. They're not scientific, and there's no evidence to support them. People are following those because they're afraid, and they're reaching out to someone to save them. And this is the plan, is to create fear among the public so that they will do whatever you tell them. And people have to start thinking for themselves.
In your letter to Dr. Henry, Dr. Malthouse, you explain, well, although I'm sure she knows, but the rest of us don't, you explain what a case is. And maybe you could just comment on that, because it's not exactly what we're being told these days.
We are seeing cases going up because there's more testing being done. In fact, we've had more cases now than we had at the peak of the first wave, so to speak. And that's because the more PCR tests you do, if 9 out of 10 of them are inaccurate, false positives, then you're going to have way more positive people. Now, when they call a case in regular medical lingo, it means someone who's actually sick, who has symptoms and often needs to be admitted to the hospital. That would be a case. But nowadays, a case is anyone with a positive PCR test. Now, if we base all our practice on our policies on PCR testing, which we know is false, a recent court decision out of Portugal actually decided that the PCR was not accurate, was inappropriately being applied here. And that was a very important decision. If we base everything on that, and cases which may be asymptomatic, people are not even sick and they're not contagious based on the Chinese study, then we're completely going down the wrong road. And if we look at all the harms, the collateral harm that's being caused by these policies, we better make that 180-degree turn and go back the other way if we want to save our country.
Do you have any idea why the media is not reporting on the types of things that you're talking about?
Well, the media gets 50 to 70% of their income from the pharmaceutical companies. The pharmaceutical companies are going to profit big time from this, in the billions and millions of dollars repeatedly every year from the vaccination and other drugs they might sell alongside that. So there's no motivation for them, and I would say that they're completely captured. You're not going to get your information from mainstream media. In fact, I recommend putting your television in the garage for the next 6 months.
You say to Dr. Henry in your letter to her, you say, it's your duty as the provincial health officer to provide facts. What do you think our public health people in BC and right across Canada should be doing now?
I think our public health people, including Dr. Bonnie Henry, should be saying that we made a mistake. that looking at the data now from the earlier part of the year, we've seen that the public policies we rolled out were not helping people, and we're actually harming them for now and for the future, way beyond any type of epidemic or pandemic, and that we need to apologize and to do something which is science and evidence-based. And that's what I think that the public health should be doing.
Are you alone in this, or would you say there's at least some support within the medical and scientific community in Canada and around the world for what you're saying here?
Well, what we're seeing is that all the doctors and scientists, epidemiologists, researchers, everybody who is actually looking at the data is saying the same thing, that this lockdown, face mask wearing, washing your hands excessively, isolating people unnecessarily, locking down businesses or causing them to close, closing churches, that all that is baloney. By that, I mean it's not based on science. And all of them are being blocked by mainstream media. People who are going to have to look elsewhere to get their information and to learn how to evaluate it themselves. But I'm not a lone voice in the wilderness here. There are thousands and thousands of doctors and scientists speaking out against what's going on around the world. And if you look at it, you say, well, why would all our public health people, our governments being, giving us the wrong information? Well, that leads you on to the next question as to what would be the motivation for someone to try to implement policies which are actually killing people.
What would be the motivation? What is then behind all of this? Now, I happen to agree with you. I don't think the pandemic is real. I think we're being given false information. I think the death numbers have been exaggerated immensely. And it's if you watch the media or listen to the politicians, it's all fear all the time. Now, I don't say I'm right in that thought, but it is what I think. But if you do think that, then we have to look at what is the reason for doing all of this, because it's not an accident. If the death numbers are being artificially inflated and we're being scared by cases, which, as you just said a few minutes ago, medically are not cases, then what's behind it?
That's a good question. I'm not sure if you want to go there, but that's the big leap for people, right? That's the big step forward, to think that it's such a big lie that it's hard for people to comprehend or to accept, and people do not want to accept it. That's why they're more willing to place their trust in someone that they can see their policies are absurd. It's an illusion of safety that they're offering you, and that's what people are clinging to because they're so frightened.
Yeah. You mentioned earlier how many the PCR test uses doublings. They keep doubling and doubling and doubling the small bit of virus they get. And if you go over a certain number of doublings, the test becomes completely irrelevant. I asked Adrian Dix's office, the Minister of Health in BC, for what's the number of doublings that are being used. And I mean, that's a very straightforward number. There's no reason not to get it. And yet they won't tell us what it is. And we're almost out of time.
But here's what they've done is there was a study came out which looked at all the provinces. They were not able to get the information directly from the provinces. Most of them were withholding that information, but the numbers are 33 to 45 across the country. That includes, I think, all the provinces they were able to get, which was the majority of them. So 33 might be acceptable, but usually they're saying that 25 to 30 is the maximum you want to do this amplification, what they call amplification or cycle threshold, CT cycle threshold. That would be the maximum, would be 30, and they're doing 33 to 45 in Canadian provinces. They won't tell you because the whole thing falls apart when you see that they're creating an amplification such that just about everything will be positive. Now you wonder, why would they do that? Well, they're doing that because they're being told to do that. And they're being told to do that because we want to create a case-demic, which is not, people in the hospitals. Of course, we're seeing now an increase in hospitalizations, which we would expect from this time of the year. This is perfectly normal. And as the fall goes into the winter, we'll see that the numbers continue to be what we would expect.
Our hospitals are always full at this time of year. Dr. Malthus, we're out of time. Thank you very, very much for doing this interview. And who knows where we're going, but thank you very much. And thanks to everybody for watching this segment of Citizens Forum.